Implementing Continuous Improvement Culture, a conference room at Healthway Regional Hospital. Dr. Maya Patel, Chief Quality Officer, is speaking with a group of department managers about the hospital's continuous improvement journey.
Thank you all for joining today's session on our continuous improvement journey. As you know, 5 years ago, our hospital faced serious challenges. Our patient satisfaction was in the bottom quartile, and staff turnover was approaching 30%. Since then, we have transformed our culture and our performance. Today, I want to share some key lessons we have learned along the way.
Maya, before you start, I'm curious, what was the turning point? When did you first see real change happening?
That's an excellent question. We launched the program in January 2020, but I'd say the real turning point came about 6 months later. We were struggling at first because people weren't comfortable reporting problems. Then we had a situation where a nurse reported a near-miss medication error. Instead of disciplinary action, we celebrated her for speaking up and used the incident to improve our medication protocols. That changed the perception completely.
I remember that. It was quite powerful, but didn't. You also implement some specific methodologies. It wasn't just about culture, right?
Absolutely. Culture is foundational, but you also need structured approaches. We have adopted several key methodologies. First, we implemented daily management systems with visual boards in each department. Since the implementation, we have seen much faster identification and resolution of issues. Second, we trained staff in problem-solving techniques like the 5 Whys and PDCA cycles. Over the past 3 years, we have trained more than 400 employees in these methods. Third, we established a tiered problem-solving approach. Frontline staff handle simple issues immediately. More complex problems are escalated to department improvement teams. The most challenging issues come to our cross-functional improvement council.
I have noticed that some departments have embraced these approaches more than others. What have you found works best to get everyone engaged?
You're right about the variation. What has worked best is demonstrating quick wins and celebrating success. For example, when the emergency department reduced wait times by 40%, we made sure everyone heard about it. We have created a monthly improvement showcase where teams present their projects. This peer-to-peer sharing has been much more effective than top-down directives.
How do you balance continuous improvement with daily operations? My team is always saying they're too busy putting out fires to work on improvement.
That's a common challenge. What we found is that you need to start small. We began with just 15 minutes per day for improvement activities. Over time, as improvements reduced the firefighting, teams were able to dedicate more time. Now, most departments allocate about 10% of their capacity to improvement work, and they see it as an investment that makes the other 90% more effective.
We have been trying to implement some of these ideas in my department, but we have struggled with sustainability. We make improvements, but then people drift back to old ways. Any advice?
Sustainability has been one of our biggest challenges too. 3 things have helped us. First, we developed clear standard work and visual management to make the new way obvious. Second, we incorporated the changes into our auditing processes. And third, perhaps most importantly, we have involved the people doing the work in designing the improvements. When people help create the solution, they're much more likely to sustain it.
You mentioned metrics earlier. How have you measured the impact of all these efforts?
We track both process and outcome measures. For process measures, we monitor things like the number of improvement ideas submitted, implementation rates, and staff participation. For outcomes, we focus on our strategic priorities: patient satisfaction, clinical quality, staff engagement, and financial performance. Since we started this journey, we have improved on all these dimensions. Patient satisfaction has increased from the 23rd percentile to the 92nd percentile nationally. Staff turnover has decreased from 30% to 12%. And we have avoided approximately $4.2 million in costs through quality improvements.
Those results are impressive. What's next for our continuous improvement journey?
We have established a good foundation, but we still have many opportunities. This year, we are focusing on 3 priorities. First, we are expanding our training to include more advanced statistical methods. Second, we are developing a more robust system for sharing improvements across departments. And third, we are working to better integrate our improvement work with our strategic planning process. The journey of continuous improvement never really ends. That's why we call it continuous.